and thank you for attending the Animal Welfare Foundation's free lunchtime webinar for this month. Today we're featuring a brand new topic, so very excited to have Nicola Gladden with us today. She will be speaking about an area that she's an expert in, which is pain relief during calving. And Nicola is one of AWS trustees. She's also had a long history being a veterinary surgeon. She's a specialist in cattle practice and currently works at the University of Nottingham as a clinical assistant professor. So yes, we're in very good hands. Very lucky to have Nicola talk to us about this topic. And before I hand over to Nicola, I'll just do a brief introduction to the Animal Welfare Foundation if you're new to us or haven't heard of us before. We are the British Veterinary Association's charity, and we're a science-led charity supporting people working in the veterinary professions to understand and improve animal welfare. And we have three main activities. The first one is that we fund research on animal welfare challenges and try to identify solutions. Secondly, we provide education to the next generation of animal welfare advocates. And thirdly, we facilitate constructive debate on animal welfare issues. And the debate sessions that we hold take place at our annual conference, which is the discussion forum. And we also have some events at other events throughout the year where we have a presence. So because this is a student talk, it's aimed at students. Obviously it's of interest to lots of other people outside of students, but the content is aimed at students. So because of that, I'll just give you a brief introduction into what we offer our students and how you can get involved with AWF. We have student grants as well. So we do offer grants to students to undertake research into animal welfare. Our 2025 student grants are currently open. They're open until the end of this month. So if that's of interest to you, certainly have a look at that on our website. We also host a variety of these student talks, so lots of different topics, and that's certainly something that you could host yourself at a university if that was of interest to you. So more information about how to book in a talk at your university is on the website, or you can attend these webinars. There's lots of recordings as well from previous webinars, so certainly have a look at those. We have lots of resources on our website for students. We have case studies to help you get a better understanding of animal welfare and how to address ethical issues. And we also, as I mentioned before, we have our annual conference, which is called the Discussion Forum. We really encourage students to attend. So if you are free on the 19th of May, please think about coming to the Discussion Forum. It's a day completely dedicated to animal welfare discussion, and students get heavily discounted tickets. So yeah, we really love students to participate in that. So that is also on our website if you'd like more information. And there's a newsletter that's sent out, so you can subscribe to that or stay in touch with us on social media as well. I'll hand over to Nicola now. There's going to be a couple of polls, so there'll be a QR code on the screen when those pop up. If you have your phone ready, just scan that code so that you can participate in the poll questions. And if you have any questions, you can either pop them in the chat on Teams, or there's also a Q&A section on the poll system that we're using called Slido. So when you go to submit your answer in a poll, you'll see there's a separate tab which has a Q&A. So feel free to put any questions in there as well, and Nicola will answer those at the end. So thank you so much, Nicola. I'll hand over to you.
Thank you, Alina. Thank you to you and the AWF for asking me to talk on this today. And thank you to everybody for attending in your lunch break. So yeah, as Alina said, I'm now working at the University of Nottingham, but my research interest in my PhD was looking at the welfare of cows and calves around calving, specifically the use of pain relief. So that's what I'm going to talk to you about today. So we're going to start off just with a bit of an introduction as to what is welfare and what is pain. A little bit of a talk about the current situation on pain relief around calving. We're then going to see what evidence there is, and then at the very end, just a little bit to wrap it up as to once you do get into practice, or if you're not a student, if you are in practice, sort of what recommendations are there currently available. Just a slight caveat to that, and an apology for those of you joining us from outside of the UK. I actually didn't realise until this morning what an international audience there was going to be for this. So most of it is relevant globally, but particularly the drug choices and recommendations at the end, they are very UK focused. So if I have knowledge and where I remember, I will add as much of a global dimension to that as I can, but just sort of apologies in advance for the UK focus of that, because I just had no idea until about half an hour ago just quite how many people from outside the UK would be joining us, and you are all welcome, of course, so thank you. So I think to start with, we do need to think at a higher level, you know, what is welfare? And about, what's that, 25 or so years ago, nearly 30 years ago now, actually, there was quite a seminal paper from Fraser where they reviewed this, looking at lots of different stakeholder views, and came up with these 3 pillars of welfare. So animals should be able to express their natural behaviour. And I think particularly if you ask consumers, often that comes up as a really important thing for consumers and members of the public with regard to what makes for good welfare is animals can express their natural behaviour. Good welfare also covers health and production. So animals that have good welfare are healthy, or healthy animals have good welfare. And particularly when it comes to animals that are used for food production, then hopefully animals kept in a good welfare state have better productivity than animals who are not kept in a good welfare state. And certainly if you ask vets, they typically will look at welfare through a health lens. And if you ask a lot of vets, you know, a lot of high on their list of what makes for good welfare for our animals is good health. And finally, the third pillar, and all of these pillars interact with each other, the third pillar is affective state. So that's the emotional state of these animals. The animals should be, for want of another phrase, they should be happy, they should have a life worth living, and they should sort of, you know, be feeling, as much as we can tell, and if we are to apply some anthropomorphism, sort of enjoying life, we're getting some enjoyment out of life, not just existing. So how can we assess welfare? Because it's all well and good, but knowing what welfare is and understanding the concept of welfare, which as an aside is actually quite hotly debated, what welfare really means. But really, particularly as vets, we do need to be able to assess welfare, because if we can't assess welfare, how can we tell if these animals have good welfare or poor welfare or even neutral welfare? And traditionally, the 5 freedoms framework was used. This is something that I think a lot of you on the call are probably aware of. The 5 freedoms were established in the 1960s in the UK and became really the sort of leading framework. A lot of, certainly in this country, a lot of the welfare organisations use the 5 freedoms to assess the welfare of you know, cases they're involved with, etc. But a criticism of the 5 freedoms is this is essentially all of these freedoms are absences of negative welfare state. So freedom from hunger and thirst, that's the absence of hunger and thirst. Freedom from discomfort, so the absence of discomfort and negative state. Freedom from pain, injury and disease, again, absence of a negative state. None of these conditions really consider a positive welfare state, and therefore the affective state pillar of welfare is not really captured by these 5 freedoms framework. So more recently, the 5 domains model has been proposed, and this is gradually gaining traction. This model was proposed about almost 20 years ago now, but it's starting to gain traction and becoming more and more popular as a method of assessing welfare. And the advantage of this is it builds on the 5 freedoms, and it has these sort of four domains: nutrition, physical environment, health, and behavioural interactions. And they all factor into mental state, which is the affective state, and that leads to the welfare state of the animal. So this covers and captures positive welfare and the affective or emotional state of the animals, as well as their expression of natural behaviours and their health and productivity. And also, whilst in this image, these arrows are going from domains 1 to 4 into domain 5, because all of those domains affect the mental state of the animal. Actually, this is a two-way thing. So the affective state of the animal can affect their health, can affect their nutrition, and can affect the behavioural interactions. Maybe less so affects their physical environment, but all of these go together to contribute to a welfare state of the animal. And so what is pain, and how does this relate to welfare? Well, pain, I don't know if you know this or not, but the definition of pain is recognised at global level, and it is proposed by the International Association for the Study of Pain. The most recent update to the definition was in 2020, and that included this phrase, or resembling, and that acknowledges that non-human animals start to feel pain, but because they're non-verbal and because they're not humans, they can't tell us how painful they are, and sometimes we don't necessarily recognize their pain in an obvious way, because some of our animal species don't present pain in the same way that humans do, so we don't immediately recognize this. And pain is an unpleasant sensory and emotional experience, so that means pain is a negative or is an affective state. There's an emotional component to pain, and it's associated with, or resembling that, associated with actual or potential tissue damage. Just a quick reminder back to early vet school as to why this is the case. So you get a noxious stimulus. So if you put your hand on something hot, the heat there is a noxious stimulus. And that stimulus is transferred through a method called transduction into the spinal cord and then up to the brain through transmission. The stimulus then is perceived in the brain, and this is where the affective state comes in. So this is where the emotional component of pain comes in, because it's perceived by the brain, and then that is what gives us the actual feeling of pain rather than just the noxious stimulus. And then there's a descending inhibition called modulation, and that is why over time, if you, for example, you do put your hand on something hot, you think, oh gosh, that's extremely painful, but then very quickly afterwards, although it becomes still quite sore, it's not as painful as that initial insult when you first experience that noxious stimulus of heat, and that's because of modulation. So let's link the two together. We've got our 5 domains model here, which I'm going to use throughout this as the update to the five freedoms. And so we know that pain affects the mental and affective state here, so domain 5, and it's a negative state. So pain is not something that is enjoyed or is a positive state. Pain is negative. It's a negative affective state, so that affects domain 5. So domain 5, this can be caused by compromise to the other 4 domains. So for example, let's take health as an example. Let's say our animal is experiencing a painful disease. The animal is in pain, therefore its mental and affective state is negatively affected, and its overall welfare state is affected. However, let's say the animal is painful for some other reason, and then that animal, because let's say the animal is painful because it's lame, it's laying down a lot. So then that animal, if it's a dairy cow, it's laying down possibly in a dirty environment, that increases the risk of that animal developing mastitis. Therefore, the pain and the animal's response to that pain has contributed to a new health event for that animal. So that's going in 2 directions, the compromise there caused by pain. So pain is very important when it comes to welfare, and it is a negative welfare state that we do need to avoid or mitigate as much as we possibly can. So let's bring this back to calving. So firstly, what pain happens at calving? And for those of you who are in any doubt, and I regularly get asked this, calving and parturition generally is painful. There's quite a lot of research that shows this now. Certainly parturition for mammals is painful. So in stage 1 parturition, visceral pain predominates, and this is related to the dilation of the cervix and contraction of the myometrium. Once the calf starts to engage into the pelvis, you get increased myometrial contractions, you start to get somatic pain then, and that predominates. And that predominates until the calf is then born. Why is this important? Well, calving is an essential part of management of adult female cows, of which there are billions probably across the world. So this is affecting millions, if not billions, of cows worldwide, and it's been known for some time. So this picture on the right here from the Royal Ontario Museum, this is actually an ancient Egyptian artifact demonstrating an assisted calving. So we know that animals have been assisted, or cows have been assisted for calving probably for thousands of years. What we don't really know is how beneficial pain relief is. We certainly didn't until the past sort of 5 to 10 years, because there'd been limited to no research. And when it comes to calves, I started my PhD in 2014, my PhD research 2014, and at that time there were 0 studies looking at whether being born is painful and whether calves benefit from pain relief. So the past 10 years, though, there's been a lot of interest in this and a lot more research. But is pain relief being used in practice? So here's a Slido. So if you have been seeing practice, or if you're even in practice, have you seen or used pain relief at calving, or have you heard of it being used either by farmers or vets? Excellent. Thank you all for participating in that. So we can see here that 2/3 of the respondents are saying no. And that is consistent across the board. And when I present this, I often ask this question. I present this quite a lot. I have done over the past 2 or 3 years. And the majority of people always say no. And this is consistent in the literature as well. So we're going to talk about why this might be. So a study from 2017 found that whilst vets will score, dystocia as a grade 7 out of 10. So 10 is the most unbearable pain possible. So that's a pretty high degree of pain. Only 80% of them say they'll use NSAIDs and give NSAID pain relief to these. They might be using other pain relief, like, for example, epidurals, those sorts of things. But there are limitations in that pain relief, and we'll come on to that at the end of this talk. Better news, though, for caesareans, 100% of vets will give, certainly they responded to that study, would give cows some NSAIDs after a caesarean. What about farmer usage, though? So these are different studies, but one's from 2007, one, the Moggy one, so Huxley and Way, and the previous one that I just talked about, they're both British studies. The Moggy study here at the bottom in the orange table, that's from, I think that's a Canadian study. And we can see here that farmers, about 50% of farmers, would like their cows to have pain relief after having dystocia, and nearly 40% in calves. And that study was sort of 16 years ago now, so so that's before any of this research was going ahead. Moggy study 10 years later did find that fewer farmers in Canada would give their cows pain relief and their calves pain relief at calving for dystocia, and also fewer for cesarean sections as well. But having said that, these were from the Moggy study as well. So 89% of farmers thought dystocia is painful, and 88% thought cesarean is painful. So, so we're seeing a high recognition of pain here, but we're not seeing equivalent levels of pain relief, certainly where NSAID pain relief is considered at least. And this is a different study from 2022, so a bit more recent, and this is a study from the Republic of Ireland. And this looked at lots of different types of painful conditions, but if we just look at the ones relevant to this talk, we can see that top graph there is farmers, and we can see the yellow bars show the percentage of farmers that would like NSAIDs to be used, and the red line is the pain score that they gave. And you can see here that for cesarean section, they're scoring again a 9, very similar to the vets in the study 2 slides ago. And similarly to the vets again, they're scoring dystocia at a grade 7. But only about 3/4 of farmers would like pain relief given to these cows, that they're scoring at a 7 out of 10 pain. Comparatively, cesarean section, almost 100%. And I suspect that's because a cesarean is surgery, and it's I think more relatable to people that surgery is clearly going to be a painful condition. What's interesting here is if you look at the oh, actually, sorry, we'll look at the vets first for those two. So if you look at the vets, they're actually scoring, in this study at least, cesareans and dystocia, both slightly lower pain scores than farmers. So they're giving cesarean about 7.5 out of 10, and dystocia just below 7. And again, what they're saying is, although we're scoring this 7.5, about sorry, I've got it the wrong way around. So scoring about 8 out of 10, sorry, but again, only about 75% of vets are giving cows with cesarean section or having cesarean section NSAIDs after their surgery. And similarly for dystocia, less than 3/4 would give pain relief to their cows with dystocia, even though they're scoring this at nearly 7 out of 10. What's also interesting here is, so calving with no assistance was not part of the survey for vets, so only farmers were asked about calving with no assistance. And we can see here, this is where there's the biggest discrepancy, actually. So we can see they're scoring this at a 4 out of 10. So I would argue that's still fairly moderate pain. It's nearly halfway on the score, but only about 10%. In actual fact, I think it was something like 9% of farmers would give pain relief to their cows that calve without assistance. So what's all this research collectively telling us? What this is telling us is both vet surgeons and farmers, they recognise that calving is painful. There's a high recognition of pain. Generally, dystocia is considered to be more painful than an unassisted calving, and cesareans are also considered more painful as well. However, what we know is that recognising calving is painful does not transfer to an increase in use in pain relief for these animals. And this is not just farmers. I think when I speak to vets, there's always a temptation to think, oh, with vets, we give everything pain relief. It's the farmers that are having the issue here. But actually, it's not just farmers, it's vets as well. And the literature would suggest that vets might be even using pain relief a bit less than farmers are. It's also worth noting that this is not a phenomenon seen just around calving. And if we quickly go back to these Brown studies, we can see here all of these conditions, they're all considered reasonably painful, but there's quite a lot that less than 50% are giving, 50% of vets, or a few, less than 50% of farmers are giving these animals pain relief. So this is a common phenomenon that is seen, that the recognition of pain does not necessarily equate to the provision of pain relief. So why is this? So why do you think this is? What barriers do you think exist to the use of pain relief in our cows at calving? This is a word cloud, so please be respectful and relevant in what you write in the word cloud. Thank you. Excellent. Great. Thank you very much for contributing. There's just a few more coming in as well. Brilliant. Thank you. There's some really good ones here, and interesting that natural pain has come up. This is a really common thing that I get told a lot. You know, calving pain is natural pain and therefore it doesn't need pain relief. This is not something we can ask the cows. Personally, I would dispute this, and hopefully I'm going to persuade you from this presentation to maybe think again about that. Lack of empathy, I think that's interesting. And the Brown study from 2022 that I've just shown you, they actually did look at empathy scores. What's come out here at the top, though, is withdrawal periods, and I think that's really interesting that we do need to think about that. And in the UK, we're really lucky. We've got 2 types of NSAID pain relief with 0 withdrawal period, and I do recognise that that might not be the case for some of you who are not working in the UK, and it is a really important thing, and it can be quite a frustrating barrier to improvement of welfare of food producing animals. But what has come out at the top as the biggest one is cost. And that is when I do this presentation, whether I'm presenting to vets or to vet students or to farmers, well, not so much to farmers, but vets or vet students, it always comes out as cost as the top, and you are in really excellent company, because that's what everybody thinks. So thank you for for doing that, because it means the rest of my presentation is not redundant. So let's think about what the literature tells us. What about our farmer perception? So age of animals. So this was, again, so the Moggy study did a lot of qualitative work, and they got some most of these studies just sort of do surveys and the farmer sort of yes or no type things, or scoring sort of like a scale type surveys. What the Moggy study did is they actually had some focus groups, and they asked farmers what they thought, and they did some qualitative work there. And age of animal came out as a barrier. So so very young animals were considered to have lower pain or higher pain thresholds, or feel pain less than older animals. There's also a perceived bovine tolerance to pain as well. This is very questionable, because the trouble is we don't actually know. So we can't speak to cows. We can't say to cows, do you feel this level of pain? How do you score your pain? So we don't know. What is probably more likely is that as humans, we just can't identify bovine pain as well as we think we can, because cattle as a ruminant species, They don't tend to vocalize unless they are in extreme pain. They just don't respond to pain and show behavioral indicators of pain, particularly more subtle pain, in quite the way that we can relate to as people. Access. So some of the people in the word cloud did mention various different aspects of access, and yet there is definitely an issue with access. It's probably variable even down to practice level, let alone country level. But there's a lack of awareness of pain relief availability, and there's a lack of knowledge regarding efficacy as well. And these are areas in particular where vets, especially when your pain relief drugs are prescription only medicines, so they have to be bought through vets, this is an area where vets can be involved here. They can make farmers more aware of the availability of pain relief, and they can discuss with farmers about the efficacy of these drugs as well. I would say certainly in the UK, I think the awareness problem is certainly reducing because drug companies are more and more marketing their pain relief. So in the UK, drug companies are allowed to market prescription-only medicines direct to farmers because farmers are considered as professionals. They are no longer allowed to market antibiotics though direct to farmers, so they are marketing pain relief a lot more, and so farmer awareness of pain relief availability is, in the UK at least for that reason, is growing. So if we're thinking about cost, we're going to talk about cost in a moment, but just before we start, how much do you think farmers might be prepared to pay for pain relief at calving? So again, this is a word cloud. Thank you. So about £10 is coming out. So so that would probably be what, about sort of $15-16, something like that, American dollars, or about maybe sort of 12-13 euros. What is coming out here as well, and you're absolutely right, actually it is more nuanced than this, and there does usually need to be a perceived benefit, and the amount that they might be willing to pay is variable depending on the type of animal that we might be giving this pain relief to. And you're absolutely right to highlight that, because that is definitely the case. So is cost a barrier? It's not very clear cut, actually. So the Moggy study from Canada said, yes, cost was cited as a barrier, but they didn't explore what farmers might consider to be acceptable costs. And these are both drug and labour costs. So remember, having to catch an animal to inject it, that's time, and that's labour time, and there's a cost to that. Excuse me. However, John Remnant's study for 2017, so that's a UK study, and the Brown study from the Republic of Ireland a couple of years ago, it was not as clear cut as that. So, and this was a study some of my colleagues did at Nottingham a couple of years ago now, where they looked at barriers for pain relief for treating illness in calves. And this was one of the quotes from the farmers, in that actually they would value the calf's health and comfort over the actual cost of treatment. So what do vets think acceptable costs are? If we look, if we look here for In cows, sort of dystocia generally actually considered a little bit higher than so about 10 to 20 pounds for dystocia, whereas caesareans sort of 10 to 20 and 20 to 35 were fairly similar. If we look at calves, obviously calves are smaller, so they use lower volume of product, and therefore it is going to be cheaper. But vets considered sort of less than £2 to be an acceptable cost for calves. By comparison, if we look at a study that asked both farmers and vets, we can see here that in the 0 to €5 category, this is for cows, not for calves, we can see actually that vets, not that many vets thought that's an acceptable cost, and more farmers thought that that was an acceptable cost for these caesarean dystocia and unassisted calving. By contrast, though, if we look at the upper end, so over €30, when it got to this, farmers were actually, although they were more likely to say a very low cost, they're also much more likely to say a high cost. So only 16% of vets thought over €30 was appropriate for caesarean, and only 7% thought that over €30 was appropriate for dystocia, and that compares to 45 and 24%. So there's a big discrepancy there that farmers, quite a lot of farmers, are prepared to spend quite a lot more than what vets think they are for pain relief. And we look here at the overall figures. We can see that 98% of farmers would like their cow to receive NSAIDs for caesarean and 73% for dystocia, whereas actually not that proportion of vets are using these drugs. So again, there's a discrepancy there between how many farmers would like these drugs used and the proportion of vets that are actually using them. And one of the key things from this study, so actually going back to the word cloud where someone mentioned empathy, this study actually did look at empathy scores of some of the respondents, and they found, interestingly, the empathy score did not seem to affect it. So these you scored, so whether people were scored as being more empathetic or less empathetic, that interestingly did not seem to affect whether the likelihood of whether they would give these animals pain relief or not. And that was the same, from my memory, that was the same for the farmers and the vets as well. And that's quite an interesting finding, because you would expect that people that score highly on empathy might be more likely to use pain relief. That is something that is not well studied, and we probably need other research as well to see if that's a repeatable finding, but it was an interesting finding nonetheless. What they did find was that, one of the key things they found from this study was that vets did perceive cost as more of a barrier than farmers did, and said should therefore be offered more readily to farmers, and farmers should be made more aware that they exist, particularly when vets are gatekeepers of NSAIDs, because these cows are not going to get the NSAIDs if the people selling the NSAIDs are not even discussing it with the farmers. So the farmers are not aware that they exist as an option. So what's the evidence? We're just running a little short on time, so I'm not going to dwell too much on this. There's quite a lot of research findings in this section. So if we start looking at findings of my research, we know that assisted calving is associated with reduced welfare. So cows and calves that have assisted calving or birth, they spend more time laying in lateral recumbency, so an uncomfortable lying posture. We also found that if these animals were given pain relief, again, they spent so the calves certainly spent less time in lateral recumbency, and I think these are two of the wrong way around, actually, because the cows also did spend less time in lateral recumbency. We also saw a little bit of an interaction effect as well. So calves who were treated with pain relief, which was ketoprofen in my study, if they were unassisted, they seemed to show the greatest benefit compared to assisted calves. And our original hypothesis actually was that cows and calves born or experiencing assisted calving would benefit most from pain relief. And that did not come out of the study. That hypothesis was not proven. And in some cases, the unassisted ones seem to benefit more, actually. If we go back to the beginning and start thinking back again about our measures of positive animal welfare and our effective state, play behaviour, particularly in calves, is a really good indicator of positive animal welfare. Animals who've got all their other welfare needs met are more likely to play, and it's a positive effective state. And what we found was calves who were administered ketoprofen, they showed more play behaviour than the placebo control calves, suggesting that ketoprofen is associated with ketoprofen administration associated with improved positive welfare. And by contrast, the assisted calves showed less play behaviour, again supporting our hypothesis that calving assistance is associated with poorer welfare of the cows and the calves. We followed this behaviour, it was just for the first 2 days after calving, so how the animal's welfare was beyond that, we didn't study. Going back to the word cloud, we said, okay, well, you know, the amount you pay is fine, but you know, it is more nuanced than that, and there needs to be some sort of recompense, so to speak. We can see here that so we can look at productivity basically, and if productivity is improved, then we can say, well, okay, there's a financial benefit to doing this as well as a welfare benefit. If we look at the effects of assistance, calving assistance consistently is associated with poorer productivity, poor reproductive performance, and increased risk of disease and culling after calving. We didn't see much effect of NSAID use on those two, but we did see an effect of NSAID use on projected milk production. So the 305 ME, so that's a standardized milk production measure of cattle that were given ketoprofen in the subsequent lactation, was over 600 kilos higher than the cows that were given saline. Now, how much of an economic benefit that is depends on what the price per litre of milk is, but it's certainly, you know, your milk would have to be extremely cheap for this to be less than the cost of a single dose of ketoprofen, which is what we gave them. We also found that in the assisted calf group, the calves given ketoprofen, they grew about 100 grams a day more quickly than the calves in the other three group. And we also found that for every 100 grams a day increase in average daily gain to weaning, that was associated, that had positive effects on their first lactation reproductive performance. So CCI there is calving to conception interval, and also they needed fewer AI attempts to conceive as well. So so calves that grow more quickly seem to have better reproductive performance in their first lactation. So that's a very long-lasting effect, and that was an indirect effect that we saw, beneficial effect that we saw of giving pain relief to calves when they were born. Yeah, and we can see here that birth assistance was associated with poorer productivity as well. So again, we probably shouldn't be assisting these cows and calves at calving unless it's absolutely necessary. So it's all well and good me telling you my study, but it's no good if that's the only study and there's nothing else to support that. But how does this compare with other studies? So firstly, if we look at cow behaviour, we can see that giving pain relief, NSAID pain relief at calving, with other studies, and you can see they've all been done in the past kind of 10 years or so, it's associated with increased activities, increased feeding behaviour. So really important after calving is to get those cows eating. There's some inconsistency as to whether, so Schwartz et al. Found that there was reduced activity, but generally they find there's increased activity, and interaction effects similar to our study. We're not seem to be seeing interaction effects. So this would suggest that all cows, even those that are not assisted, do benefit from pain relief. And this goes back to this being sort of, you know, natural pain doesn't need pain relief. Well, actually, even the cows who are not assisted, and therefore the only pain that they could be experiencing is related to this natural physiological experience of parturition, they are still benefiting from pain relief. So I'm sorry, this is quite a small, this is just taken directly from my PhD, but the general consensus is giving pain relief at calving is either neutral or beneficial when it comes to milk production. And the studies generally find that pain relief, if you look at early measures of milk production, so maybe just the first few days or few weeks, or up to peak lactation, tend to find no effect. If you look at whole lactation measures of milk production, seems to be that pain relief is NSAID pain relief is associated with beneficial effects. So improved whole lactation, longer term measures of milk production. If anybody is looking for some research to do, this is actually crying out for a meta-analysis to be done. So I'll just put that out there if anyone wants to do that. If we look at reproduction and culling, this hasn't been studied quite so much, but the few studies that have done it have found that reproductive performance, it tends to be improved in animals that are giving NSAIDs at calving, and there's a lower risk of them leaving the herd in those first 2 months after calving if they're given pain relief. As I mentioned, very, very few studies. So when I started my PhD, no studies. Currently, to my knowledge, there are 5, maybe 6 studies looking at calves. So if they get pain relief at birth, is being born painful for these calves? Yes, it seems to be that it is. Does pain relief at birth lead to improvements in the welfare and also productivity of these calves? Generally, we find that yes, so vigor and welfare is improved. Measures of productivity is less consistent, and it seems to depend on the study design. So that's less of a consistent finding than we find in the cows. And this is the final one. This is, to my knowledge, the most recent study that's out there at the moment. And what this group found from Hungary, so Otto Senzi and Professor Kovacs, they've done, this group that they're in has done a lot of research around the welfare of calves around birth and the welfare of cows around calving. And what they found was quite interesting was that calves who are born with low vitality, they did benefit from administration of meloxicam at birth, whereas calves that were really vital and active when they were born, they didn't show any benefit. So it might be that this is a little bit more nuanced than what we realise, and I think more research is needed here. So just to finish with, because I know a lot of you are vet students, and you might be wondering, this is great, but to be honest, it is quite academic. So how do I apply this to my practice? How do I apply this when I graduate? And this is the bit, apologies, this is very UK focused, but we have, in the UK at least, 4 main types of pain relief options for our cattle. We've got NSAIDs. These are of the group of the 4, the most long-acting ones. They're very readily available, and they've all, in the UK at least, and they've also got anti-inflammatory effects. So there's an added benefit there as well. In the UK, we have ketamine available for us for use. This is quite short-acting. It's very useful if a cesarean is needed. But there's no anti-inflammatory effect, and it's Schedule 2. It's just recently been increased actually to Schedule 2 drug in the UK, at least this is, so we cannot use this on farm. I think across the world, ketamine can be used as a drug of abuse, so I would expect that there are few countries in the world where you could leave ketamine on farm. Local anaesthetics, really useful, and I suspect that some of these vets who are saying they're not using NSAIDs at cesarean are still using local anaesthesia. Again, no anti-inflammatory use, short-acting, quite a specific use for this because they're really only useful for surgeries. And our alpha-2s as well, again, can't leave these on farm. Sedatives, quite dangerous for people in quite low doses. Quite short-acting, and again, not anti-inflammatory either. And so really, for our longer acting pain relief, sort of up to 24 hours, or in some cases, possibly slightly longer, NSAIDs are really our primary option when it comes to pain relief for cattle. I do know in some parts of the world as well, so butorphanol and buprenorphine are options as well. Again, these are shorter acting, so for longer acting pain relief, not so useful, and they're not readily available to us in the UK for licensing reasons, but they are an option if you're elsewhere in the world. So just briefly going through, there's 4 licensed NSAIDs available to us in the UK. So I'm just going to briefly go through them in relation to calving in alphabetical order. So carprofen is probably the least well studied. It's got 0 milk withdrawal period in the UK, so really handy, and there's no adverse effects reported. So it can be used, but the data are quite limited because it's not that well studied. Flunixin, again, not that well studied, but there are some evidence of negative effects, and there are some adverse effects reported, particularly the newbie studies of 2017. It's quite a big study, and they found that there was an increased risk of retained fetal membranes, and if given in first stage labour, an increased instance of stillbirth as well. So generally, I would say, unless this is not consistent, so not every study has found these adverse effects, but my general approach is that unless flunixin is really absolutely your only option, I would avoid using flunixin around calving for these cows because these adverse effects are reported. Ketoprofen, these are quite limited studies. So ketoprofen, UK studies often use ketoprofen because we've got no milk withdrawal. A lot of studies that are done in America will not use ketoprofen because, to my understanding, this is not licensed for food producing animals, or certainly not for cattle in America. So, so this may or may not be available to you. Of the studies that are available, there seems to be improved welfare. There might be an improved productivity as well, but there's certainly no adverse effects that have been reported. So ketoprofen is a good choice, especially if you're worried about milk withdrawal. And meloxicam is the most widely studied. This has been associated generally with improved welfare, and in most cases either improvements or just a neutral effect on productivity. Again, no adverse effects reported. And it's worth noting that both ketoprofen and meloxicam have both been studied in newborn calves as well, which the other two have not. Apologies for those of you who are in America and elsewhere where salicylic acid is available. This is not, or aspirin, this is not licensed for use in adult cattle in the UK. So, so I haven't included that, but there are some studies that have found some beneficial effects of using oral aspirin as well at calving. So just to finish with, so our summary of NSAIDs at calving. It's quite difficult to compare studies because the data are inconsistent, and that is partly down to study design differences. I'm sure it's also partly down to just natural variation between cows and between herds as well. But in general, overall, it seems to be beneficial to provide NSAIDs to cows at calving, with the possible exception of flunixin. The welfare benefits are the best supported, but there are some productivity benefits as well, and they are useful to have in your mind to be able to support the economic reasons for using these drugs. Although do bear in mind that that the economic reasons are actually not so important to farmers as what we as vets think they are, and a lot of farmers will be convinced by the welfare benefits. The use of NSAIDs in calves at birth does seem very promising, but there is very little data at the moment. It's also worth noting that almost all work has looked at dairy cows, and there's very little work on beef cows. So the effects are unclear, although certainly when it comes to welfare, there's no reason to think a beef cow is going to be any different when the way it feels pain, etc., to a dairy cow, because they are, remember, the same species. And also Bos indicus cows as well have not been well studied either. But again, I think they would probably benefit from a welfare perspective. How their productivity is affected, we just don't know. So there's more research needed there. Do assisted cows benefit more? Again, the results are inconsistent and we actually don't know. Most data do suggest that all cows benefit, not just assisted cows. And so what does this mean for when you qualify? My recommendation would be to use NSAIDs at calving, and also to recommend these to your farmers as well. You don't need to go over and above what's on the data sheet, so what's on the data sheet is sufficient. Do consider using NSAIDs in calves. In the UK, at least, this is off license, and I suspect elsewhere as well, because most residue studies and most safety data studies don't look at calves under about 6 weeks of age. It's also worth noting, it's a little bit outside of the scope of this, but it is worth noting that calving assistance does have a negative welfare effect. It has long-term effects on the productivity of these animals, both the cow and the calf. Therefore, we should be encouraging farmers to use calving assistance only when it's needed for the benefit of the animals and not for convenience. So thank you all for listening. Please, when you qualify, please use NSAIDs. And here are the details for the AWF. And if you did enjoy this talk, or even if you didn't enjoy this talk, please fill in the survey and give us some constructive feedback. Thank you, everybody. And thank you for your participation in the Slidos as well. I think we might have just a couple of minutes if there's any questions.
Thank you so much, Nicola. That was amazing.
Oh, welcome. Thank you. Got some questions in the chat.
Yes, looks like there's a couple of comments in the chat, and then there's just one on Slido as well. So if you want to do the chat ones first.
The ones I can see in the chat is actually from Maureen about the links to the newsletters. That's all I can see in the chat. Have you got anything in a different chat?
Maybe it's not updating for you. So we've got a couple here. We've got a thank you. What a fantastic talk. So engaging, so clear, so fascinating, so useful. Oops. Please do another soon. That was from Vanessa. And then we've got a question from Amy saying, so they don't affect colostrum quality? That's a question.
No. Interesting question. So actually, to my knowledge, there's no studies that have looked at the colostrum quality itself. We looked at passive transfer, and a few other studies as well have looked at the effects of NSAIDs on passive transfer, and there seems to be no effect, positive or negative. So the study that I did, the colostrum management was really quite uniform and very well sort of regulated on the farm, and we saw almost no failure of passive transfer in whether the calves were born to assistance or not, and whether they received NSAIDs or a placebo, and there doesn't seem to be any other evidence affecting that as well. But to my knowledge, nobody has actually tested the colostrum of the cows, so that's assessment of passive transfer in the calves is a slightly proxy measure. We're assuming that the colostrum quality is adequate because the passive transfer of the calves is good, but we've not actually done the direct testing, and that's now you're saying that I wish I'd done it, so I have to do it again in a different study. But yeah, so we assume it doesn't based on the calf studies that we've got, but we don't know for definite because the direct measurement has not been done.
Right. And a question from Holly. Thanks, Nicola. A really interesting talk. Is there any evidence for impact on metritis?
Yeah, again, really interesting question. So we don't know. So there is increasing evidence that metritis is painful, and therefore cows with metritis should receive pain relief. But there was one study, one of the Barragan studies that looked at aspirin did find there's a slightly reduced risk of metritis in cows that have given aspirin, but that's the only study that has found any effects. Most studies that have looked at metritis, including my own, have not found any effect, positive or negative at all. What we do need to remember is that cows that have retained fetal membranes are at increased risk of developing metritis. So if you were to give flunixin in those cows, then we're at increased risk of retained fetal membranes. They are probably also at increased risk of metritis as well, although it wasn't assessed in the newbie study that found the increased risk of retained fetal membranes. So I guess that's a very long way of saying one study has found a small improvement, but for the most part, we don't seem to see the other studies. A lot of studies haven't really looked at it, but the ones that have not found a negative effect, but they've not found a positive effect either. Although once the cow has got metritis, she probably should be getting some pain relief.
Right. And a message from Purna. NSAIDs are usually avoided in humans during the final trimester of pregnancy due to increased risk of bleeding and inhibition of uterine contractions. Are there any of these associated risks seen in cattle?
Yeah, interesting. And actually, when I first started this study and mentioned it to a few friends who are doctors, they were horrified that we were thinking about using NSAIDs, particularly in the calves. We don't know is the short answer. So the evidence for bleeding disorders associated with NSAIDs in cattle is limited to non-existent, and we don't think that we see these similar effects that we do see in people or in some of our other species, you know, cats and dogs, for example. It's possible that that's because metabolism of these drugs is different in cattle. It's possible because we just don't use them in such long duration courses as we do in our other species and sometimes in people as well. When we're using these drugs, we are using them at the time of calving, and there's certainly no reports of excessive bleeding at calving. Uterine contractions will have started. So with the exception of the newbie study, who initially started in first stage labour, and even then you've got some uterine contractions, pretty much all the other studies have timed their injection when they see the calf beat. So we know the cows are in second stage labour. So we're not worried about them inducing any uterine contractions or anything like that because that's already started. They don't seem to suppress uterine contractions. So we've not seen, if you compare a placebo group to an NSAID group, none of the studies that have done that have seen that there's been any delay in calving or anything like that, or any increase in the duration of calving. And because we're not using them in the sort of last trimester very much, sort of in like the transition period, any time like that, then I think the risks are quite low. If we have an animal, let's say a lame cow, for example, in the last trimester, there's nothing in the data sheet for any, certainly the 4 that are licensed in the UK, there's nothing in the data sheet to say that you can't use them. And in actual fact, they do say they're safe for use in, pregnancy and lactation. So to our knowledge, whilst I don't think it has been explicitly tested, to our knowledge, the risk is very low, and we don't think there's a risk of these problems in cattle in the same way that we see in people.
Thank you. And just one more quick question is, we've got the last one from Holly. Would you suggest repeat administration of NSAIDs once the initial dose has worn off?
Yeah, that's a really great question, actually, and I do. It depends a little bit on what the condition is, but let's say a cesarean section, for example. This is major abdominal surgery, and to me, I think it's almost illogical to just give, this is a personal view, just to put that, but to give one dose of NSAIDs that we know mostly we think they last about 24 hours, the duration of analgesia. So to do that and no more after a major abdominal surgery for these animals is probably insufficient. Ketoprofen, again, the UK license at least, is licensed for 3 consecutive days. So if you were worried about licensing, ketoprofen would be the way forward. My personal view is, yes, I do like to use more than 1 day's worth, again, depending on how painful I think the animal is. And I will sometimes say to my farmers, if your animal is showing behavioural signs X, Y, Z, give more pain relief tomorrow and the day after, kind of thing. So the farmer needs to make a bit of a judgment there as well. The literature is quite limited, so most studies do look at just a single dose. Some studies use more than 1 dose, but I don't think there are any studies that have looked at 1 dose compared to multiple doses in the same study to compare how much more of a benefit you get from multiple doses. So it is not completely evidence-based, but my personal view is yes, certainly in many, if not sometimes most situations that we're seeing as vets, the amount of pain that I would expect these animals to be in, multiple doses, sort of 3 days, maybe even going beyond that, although that then becomes off license, is warranted for the welfare of these animals.
Perfect. Great. Well, that's all of the questions. Thank you so much again, Nicola, and thanks everyone, and thanks for hanging around a little bit longer.
Yeah, sorry I ran over.
No,
thank you,
that's
and thank you
totally
for your
fine.
nice comments in the chat as well. It's very nice of you.
Great. Well, thanks again, everyone. And yes, have a good rest of the day. And if you can, yeah, log on to the website, AWF website, and follow us and yeah, keep in touch. Okay. Bye.
Bye.